stay-at-home order and to start allowing scheduled procedures. We methodically started to break down sector by sector of our economy guidelines to begin the process of a phased-in reopening. We also recognized in that process that we needed to focus not just sectorally, but regionally, recognizing that not every part of the state has been impacted by COVID-19 equally. And as a consequence, we have this variance process. And the reason I bring this up, it's very relevant to the conversation that we are about to have. And that's why I'm so grateful to all of you for joining this conversation. We're in real time drafting guidelines related to productions, TV, commercials, more broadly, the industries that unite us here together, because we anticipate rolling out on Monday, May 25th, some sectoral guidelines that would allow these counties that are in better conditions than some of the others to begin to move forward deeper and allow some modification, allow some work to be done, allow some movement in your industry. And so that's why this is timely. That's why we're grateful. And that's why I'm very honored that we have this opportunity to dialogue with particularly so many different perspectives that we're bringing to bear. I thought perhaps a member of our task force, Ted, would start with you, not just because I want to pick on you for your technical challenge there, but also because of your technical expertise. I mean, you in particular really have a sense of the globe, what you guys are doing in South Korea, what's happening in Japan, what you will start doing, I think, in Sweden and other parts of the country as well, not just around the rest of the globe. Maybe you can contextualize where you see things currently and where you're hoping we can go together here in the state of California.
Well, thank you, Governor. Once again, thanks for your leadership, and thank you for assembling such a great group to talk about this today. So one thing I would tell you is that, you know, our industry is quite important to the state and quite important to the world in terms of providing entertainment, providing escapism, but also providing employment and the keeping people sustained. This is a great time, I think, for us to figure out how we get back to work safely. Meaning the choices that we have to make today are not staying home or not. It really is just how do we get back to work safely? To your point, we are currently in production in places like South Korea, like Iceland, Sweden, and following and developing safety protocols there that are befitting the local environment. And the thing that we were finding out is there are no one-size-fits-all solution to production. Basically, there are different levels of density of population. Certainly of test more so in each of these places. So in places like Sweden, we're not doing testing, but they are doing voluntary quarantine in the weeks leading up to and throughout the production. In Korea, anyone with a symptom is immediately tested and production is shut down until you get the results. But certain protocols that we hadn't thought about before that you are employing in other places, like in Iceland, where they don't do ride sharing to set. So people are transported separately. But the one thing that is constant throughout the world is that production environments are very controlled environments. There are security budgets in place to make sure people don't come and go on the set who you don't know who they are and where they've been. So so in that way, it's a much more controlled environment. But the key to this, I think, is the getting to the place where we have the safety of everyone on the casting crew ensured. And beyond that, they have to feel safe to come and do the work of their lives. So to do that it's things like fast, dependable testing at scale. And I think being our ability to be able to lead that around the world is very, very important. To know when people come to work, that they come to work with confidence that the sets are clean and sterilized, that the people they're working with are healthy, and that they are being looked after. So it's the actual logistics of health safety, but also the emotions of that are very, very important.
I appreciate that, Ted. And I'll come back because I also want to get a sense what you're hearing in other states in a moment and where they're moving and at what pace, particularly states like Georgia and others that have been so aggressive on the production side. But first, I want to ask Stacy, because Stacy, you're interesting on so many levels, and I'm so grateful you took the time to be on this.
Thank you.
This conference call, because you're also that intersection as a stylist and the work you're doing on hair, but in this industry. And we're also looking in parallel track to provide an opportunity to make the variants and make the adjustments in your industry broadly, even outside of production, TV and commercial industry, to allow hairstylists to operate again as early as next week in some of these counties. Tell us about, I know you've got kids and this has been devastating in the short run. Maybe just fill in the blanks, give us a sense of what you've gone through in the last few weeks and where you're hoping we can go together in the next few weeks.
Well, I mean, in the beginning of this, of course, it was sudden. Everyone was thrown into it. Industry-wise, you're working on a production. Everything is shut down almost immediately, having to pack down trailers that we usually take over a week to pack down, doing it in one day, not knowing what tomorrow looks like, things being extended. At home, I have kids. They were thrown into homeschooling. The teachers were thrown into homeschooling. I'm all of a sudden a full-time teacher, chef, psychiatrist, principal, the maid, the housekeeper, I'm everything, and so it's a little bit overwhelming, having to keep my own mental health together, to present a front for my children so that they have trust and faith that everything will be okay, balancing them mentally, and academically and all of those things. As far as financially, not knowing what's happening tomorrow, taking advantage of all the things that have been, afforded to us to take advantage of, all new, trying to navigate the systems that are overwhelmed and flooded. And, I'm grateful, completely grateful for those things being extended. But as we all know, it doesn't support your normal everyday life, so looking forward, we know this is not going to just disappear overnight. So we're going to have to navigate through this virus as safely and as sanely as we possibly can. On our task force, we're trying to put together those protocols. Like I think was stated before, there's a lot of different scenarios that take place with production, and just being educated, everyone on the same page, and not only protecting ourselves, but protecting each other. If I'm wearing a face mask, I'm protecting you. And if you're wearing a face mask, you're protecting me. So just trying to figure out and make sure we have all the personal protective equipment, and we all have guidelines and protocols that work for us to be able to work in a safe environment, following, CDC, OSHA, what have you, your guidelines. Just, it's important. And, public health guidance, like social distancing, has to be enforced, because people, as far as I think, inherently don't like being told what to do or feeling controlled. Yeah. Even if it's the right thing, we turn into adult children. So I think it's important for us to be on the same page, have some understanding, some education, and implement the proper protocols.
I appreciate that. Thank you. For John, you're on the producing side of things, the acting side of things. What are you hearing? What are your colleagues saying? You're commiserating back and forth, other folks in similar predicament as you. What are you hoping to hear? What are you currently hearing? Tell us a little bit about what you've experienced. Take you off that mute, John. John can't.
I'm such an idiot. I'm so stupid. Why am I even on this call?
Thank you, John.
Yeah, make that look better.
So first of all, being on a show that's, kind of currently in production, we have a couple more seasons left on This Is Us. And, we have to go back into production to finish our storytelling. And, we have a crew of 200 to 300 people that work in close proximity. We consider ourselves a family. So when we talk about the protocols and the guidelines that we may be following when we go back into production, it's really kind of daunting to all of us, the actors. We talk all the time. I was just on the phone with Dan Fogelman, and we were talking about we may not go into production until January, depending on whether or not there's a second wave. So as much as we'd like to get back online, we are very concerned about our crew as a family, and as and we the safety of our crew, the safety of the actors is paramount at the front of everyone's conversation. So I think all of us are just kind of sitting back and waiting to hear what comes out of conversations like the one we're having here today, because we're still, the guidelines right now the social distancing guidelines are definitely, keeping us nowhere near filming until at least September here in this state. And I think, paying attention to what's going on, like with Ted's productions in South Korea and Iceland, and seeing how they fare and what guidelines they're using is helping, because I think each production is probably going to, take the overall guidelines and then come up with our own guidelines to make sure that we are protecting ourselves and staying safe. But otherwise, it's very, for us in this industry and in all of the entertainment industry, because we're in filmmaking, television, film, but we affect other industries, even live events and things like that. So I think really getting a handle on how we can protect each other moving forward is so important, because we don't want to, just destroy what we build, if you will. We build these guidelines and then we don't stick to them. We don't really trust each other to stick to them. Then we're going to destroy what we built. And I think that it's really taking our time is important, and we're just kind of waiting to see what comes out of conversations like this.
John, are people being that patient under these sort of intensely difficult circumstances? Or are people saying, you know what, I'm done, this thing's behind us, it's sunnier weather, let's just go? Are you dealing with any of that friction and tension, or are people really being thoughtful and methodical about the next step?
Well, everybody has their own kind of, how they feel about COVID-19, how they feel about every state's approach, our own state's approach. And not everyone is going to feel like this is a very personal thing. We have a lot of middle class and lower middle class actors that work in this industry, and every job counts. And a lot of our lower middle class to middle class actors have side hustles, that other job that they have. And a lot of them are in the restaurant industry. So they've lost, jobs on two fronts. Okay. So of course, people want to get back to work now, because we have to work in order to sustain ourselves. And at the same time, I think that most people are realists and understand that, the virus is still spreading. There's still new cases coming to us every day, and it affects everyone, not just the people of a certain age, and not just people with low immune systems and immunocompromised. There are people that are seemingly healthy getting the virus and not recovering from it. So I think the people that, that I've been dealing with and talking to we're more about being safe and figuring out how to survive, going back to our survival instincts and saying, hey, you know what, I don't need so much. I can live off little, and we have to do that in order to kind of survive. This is a thing, a once in a lifetime thing that most of us haven't dealt with. So it's really hard for me to even answer that question, because there's so many different right. opinions, and and with social media we hear and see all of them.
No doubt about it. Ava, I imagine you. Similarly, in terms of the production that you had to stop on a dime, and everything else, I imagine you had planned and organized. How's that reset? How are you able to sort of keep things on ice, keep things on hold, keep things together, at the same time prepare so you can move quickly when things loosen up?
Yes, can everyone hear me? Okay.
Yes.
Yeah, well, first of all, I just want to say, Governor, thank you for having me, and I'm feel very grateful to be living in California. I have loved ones who are in states that are doing what I feel are questionable things. And so I just feel proud to be here and the way that you're doing things. So thank you. For us, for me, I'm just deeply affected by the challenges of my crew members. While I can kind of comfortably sustain myself through this time, I have so many crew members, including my own brother, who's a barber on one of our productions, who literally, just had to stop and nothing else came from there. So very eager to try to figure out and develop and design ways that we can get back safely when we do get the green light. And that also that this kind of tribalism, kind of biased thinking that we're seeing on a national political level doesn't find its way into that reopening. That's something that we're thinking about a lot at Array. How can we make sure that doors are remaining open for women and people of color, that we don't constrict in our fear. And I think that's going to take up protocols and processes and some real kind of structure to guide people. Of course, my alarm's going off. Hold on. To guide, because you're working at home. There, you're not on the set. There it is. It's turning off. Okay. To guide people to that end. I think one of the things that's been positive though about this has been the new ways that we've learned to work that I never thought would work, right? And like virtual writers' rooms, right? Like remote working for staff and all of those new procedures and things that we're coming up with that we can take into this new era and kind of build from. And I think that's helpful in the way that we're designing things at Array on set. Yes, it's going to be hygiene and screening and masks and all of that, but we're really trying to look at, and I'm interested to hear from one of my grip brothers here, how we work on this set, right? Usually when you're on a film set, everyone's there at the same time. Even if you've already done your job, you've set up the lights and now you're just hanging there while the actors do their thing. What we're trying to think about is pods, moving people off. When you're done, you leave. You may be down for a couple hours at another location. You would come back. Just the actual movements and rhythms of a set being much different for the larger crew. Someone like, Stacy's crew, they'll come in, they'll do the hair and makeup, and usually they stand by for touch-up, in running in between every shot. We need to figure out new ways to, hey, maybe we're gonna have to figure out that shine in VFX, right? Whatever's on the face, right? New ways to keep people in smaller groups and to congregate a little less on the set. So those are some of the things we're thinking about because I can't help the timing that we get back, but we can make sure that once we're back, we're safe, we're solid, and we're doing everything within our power to keep people working happily.
So interesting. Ava, thank you for sort of prompting. Let's turn it over to Danny to help sort of answer some of those questions. Danny, that, creates a construct in terms of, how you're used to doing business. And, I imagine you guys, and you're working very actively within the union as well, probably sharing best practices and getting a sense of how we can operate radically differently as we move in this new phase until we get that vaccine or immunity. Tell us a little bit about what you guys are thinking in that respect. Maybe pick up on what Ava was saying.
Yeah, thank you, Governor. Thank you all for having me. To speak on what Ava was speaking of, as soon as this happened, 150,000 union members were launched into unemployment. And we are, as a whole, an industry of problem solvers by design. So the first thing that we did is like, okay, this is the problem. How are we going to solve it? What do we need to do? What changes do we need to make? I launched myself into asking all these questions and found myself here talking to a lot of the crew, having several Zoom meetings on, okay, what needs to happen? We think that we need to lessen the crew, the numbers of crew on set at certain times, like Ava was speaking of. I know that corporations that we do jobs with already instill the pod aspect of it. wearing wristbands means certain access to sets and no access for others. It kind of keeps the numbers of people cross-contaminating down to a minimum. I think we have been practicing that, and especially on the commercial side, and it is doable. I think that, like Ted was speaking of, the productions around the world are showing us how this can be done. They're kind of setting the precedent of protocols that are working and that seem to be working, that we can kind of feed from. And we're kind of forming our own protocols, and we're going above and beyond because the last thing we want to do is have our industry shut down again. We're hiring epidemiologists to look over our protocols, to give us suggestions of like, this will work, this won't work. So I think that we're really doing our due diligence on our end to make sure that all of our workers are safe. The problem that I see and that we've discussed in several of these meetings are that someone needs to pay for all this. And so there's a very fine line in the middle of all this of having as safe protocols as possible to keep everybody as safe as possible, but also keep it within the constructs of financially feasible for production to afford this. And the last thing we want to do is price ourselves out of business. And I know that much like budgets already, productions go elsewhere, to different states, to different countries where labor or union restrictions are a little softer and expenses are a little lighter. Might be more incentive tax-wise to go somewhere else. And we're trying to find that middle ground that's going to keep everybody safe, but yet make it affordable for everybody to still come to work. That's our main challenge. That's what we're working on, is to find that middle ground. And I think we can find that. And I know that the California has great film incentives now. There's going to be a competitive nature back with that again, I believe, to get the business. So that's something we're going to have to look at later as a state to maybe entice a little more tax incentive to keep production close. So those are the kind of the things that we're working out right now.
Really helpful, Danny. Thank you for that. And I certainly appreciate the need for this state to be more competitive in this space. And let me just stipulate to that, because that's obvious. The world competing against the world we invented is now competing against us. So we cannot rest on our laurels. And frankly, for a few decades, I think there's ample evidence we did, and we paid a price for that. And so we have to be more competitive. Ted, Ted, you and I, we talked a couple of weeks ago, and I thought it was really an interesting conversation, and the extent you want to share components of it. You made some really interesting comments to me about distinguishing between the types of production. You could talk about reality TV being very, very different in terms of addressing some of the issues that Danny was bringing up versus, voiceover work for animation versus, a quick TV series versus full-on production. All of that, we have to sort of begin to break down within the sectors. You want to amplify that a little bit so we can sort of get our arms, start thinking about that more?
Yeah, so we were talking about the ways that you enter back into the work. First and foremost would be, do I recognize that each of these productions have very different dynamics? And what we had found, first of all, I would say that the resilience of this industry has been remarkable, in my opinion, which is within a few days of shutting down productions and post-production, post-production was already starting to ramp up remotely in all different capacities. Right. Our animation teams immediately within a few days, certainly within a few weeks, had their entire productions running remotely from people's homes. Post-production, we have right now about 220 productions that are in various states of post-production all over in people's living rooms and kitchens and bedrooms. And it's happening, and just people kind of self-organized and got it going. But when it comes to physical production, that can't be work from home. So when we try to look at those things, you start looking at something like a documentary where you might be just shooting with 2 or 3 crew, shooting one person in a confined space, or even better, outdoors, where you can easily practice social distancing and those kind of things. And then it starts working its way up in the level of complexity to panel discussion shows where you have to move chairs further apart. To Ava's point, all the folks that get everybody ready for the shot, then assembling somewhere away from the production, so that they are accessible but not on top of one another. All those different things way up to probably the most difficult thing to get back going, which would be a big crowd where you have to assemble 300 people for a shot. And so that requires a lot of testing and a lot of protocol and a lot of logistics that we're going to try to figure out as we go. But don't try to figure out a way to hold everything to that crowd shot risk standard when there's a lot of production that's much simpler and easier to control than that. And then we'll get that work done too. But we've got to work our way to that, to where our level of confidence is equal across all those levels of production. And I think that's something maybe we have a unique lens into, because we are producing in just about every discipline of production for Netflix today in almost every country and every language. So we are trying to work through all those different complexities. But the way that Stacey described, the way that this shutdown happened, I mean, it happened like that. And everyone who thought knew what they were going to be doing for the next 6 months or next years, in John's case, then all of a sudden didn't know what they were going to do next. So for our productions, we have been able to continue to pay the crews for all those shows that are shut down right now. So we've got $150 million plus going into that fund to pay those crews today. And that's, for me, it's like there's a level of commitment to people that you have got to make. And you've got to know that when you come out on the other side of it, that they're going to be there for you too. So it is a mutual investment in one another, and to know that this is temporary. This is temporary. And the long term, we're all going to be back to work, and we're all going to be producing again, and we're all going to be doing it safely. And the key is, Danny's right. There is an expense associated with all of this. And when you and I talked a couple of weeks ago, Governor, we talked about the parallel between getting back to air travel after 9/11, which was their TSA protocols that if you would have told us before 9/11, if you told me you were going to have to take your shoes off to get on an airplane, you would have said that sounded pretty crazy. But not only do we do that, we figured out a way to do it pretty quickly. And then we'll figure out a way to do it and pay the TSA agents more and all those things. So it can definitely be figured out. We have, the smartest people in the world working on it. And we just have to have the level of cooperation with one another and with government to understand that, how do you work to enable a safe production, not make it impossible to move forward the safe production. And we have a unique challenge in California because we have, a city, a county, and a state that have got to get highly aligned on things. Like I have a production right now that has 3 days left, requires a heat permit, a city permit, and a state permit to get back in business. And today there are different definitions of almost everything with so we've got to work on that for sure.
Great point. And by the way, that's a helpful point in terms of just the simple permitting process and ways perhaps we can substantially align and improve on that. Ava, I saw you. Oh, sorry, Ted, go on.
And guided by the particular profile of that production, instead of what it's going to take it back in production generally. There's no answer to that. It's how to get this production going and this production going, and it's going to happen at different times.
Yeah, no, it's helpful. Ava, you made a point, and it's just interesting. I mean, you've been able to find new work styles, new arrangements with colleagues, et cetera. I mean, do you really feel optimistic that we're going to start to shift the way we now do business into the future? Or do you just think some of these adaptations are temporary, or do you really think there's opportunities here to bring in a new mindset as we go into the new normal and eventually get through this thing? Yeah, there you are, the mute button.
See?
I'm contagious.
Well done, John.
I hope that there'll be new energy that we take from this. We should take the things that really worked before and move on from the things that didn't. And that's across the board in our industry. We're seeing shakeups and challenges and rethinking of the old way, from exhibition to distribution to production. In any kind of production, there are 3 phases, actually 4. You've got prep, pre-production, principal photography, post, and the marketing. And then it goes into distribution, exhibition, all of that. The whole flow of it has been disrupted. And so I think it's an opportunity for us to say, okay, this sucks, but what can we take from it that is working and bring into the new era? What can we leave behind that was broken? Yeah. You know, with those old ways that didn't work. This is an opportunity for us to rethink that. And so I'm bolstered by that idea. And, you know, one thing I'll say about film sets, though, a good film set is a very safe place, you know, and the crew members that are here can attest to how closely crews work together to keep each other safe. And so to your question that you had asked John about appetite for people to get back, crew members are about safety. I mean, like great crew members are about safety above anything else. You have department heads here who are going to be curating who they're hiring on their crews and their departments. And that's all trickling down from the director, producer, to the department heads, to their crew. And I think that when I speak with people around the industry, it is a hypervigilance around this and a real desire to get it right so that we don't kind of take 2 steps back. Right. You know, I get it from my mama. I try to stay positive, you know, in an atmosphere that, you know, has a lot of loss. You know, I lost a family member close to me. I lost a crew member. And that can't be in vain. You know what I mean? That you can't slide back. You know, when you release the numbers and each day, and we hear how many in ICU, how many who have it. You know, you can't get to the other side of this and be in the same place. There are too many lives lost and too much we have to learn so that those deaths aren't in vain. So that's the way we approach it, and just trying to remain hopeful.
I love that. I appreciate that, Stacy. I mean, you know, all that extra burden, it's sort of in the spirit of what Ava said. I mean, this stress for you. I love what you said. You're a chef, not just, you know, a parent chef. You're dealing with mental health, your own challenges, struggles. Must be harder though. You can't virtually, you know, maybe you can in your industry, styling maybe, but I mean, some of the physical work you have to do, you're constrained by this reality. I mean, how do you see any sort of opportunities here to think anew, act anew as we move forward, or you know, how are you processing all that?
Yeah, absolutely. Like Eva said, you learn there's new ways of doing things. I have actually coached a few people through some self haircuts virtually. I don't know how well that will work for TV. That's an issue with our hair and makeup departments. There is not any social distancing. Yeah. You can't social distance and do hair or do makeup. We have our actors to think about, and actresses as well. When they're wearing masks, they can't get makeup applied, you know, so I don't know how we would navigate that. To me, if we are returning work and there's a need for a hazmat suit, it's not time to go back to work, you know, so, you know, that's an important factor. You know, it's just dealing with stress and high energy and multitasking. Like everyone here, we all do it in our industry. So I'm navigating it pretty well. And we're just, you know, trying to figure out how we will get back to work when it is time to get back to work. Like everyone here has agreed, workspace, time, you know, being careful as cosmetologists, licensed cosmetologists, hairstylists. We are licensed and we did study and learn sanitation and disinfecting. And that's something that we do on a daily basis. And like Ava said, on set, we run safely, we work safely. Our unions make us take safety classes on a regular basis. Now they'll be different. There'll be new elements to that, you know, so I'm confident that we will be able to figure out a way to navigate this and work safely and get back to work. And it's just, you know, taking our time and figuring it out and working with all the entities that we have available to us to figure that out. That's really the basis of the whole thing.
Yeah, appreciate it. John, have you been able to keep busy? I mean, you able to generate revenue, and or you doing some of the production work now, but not the acting work? Or, I mean, what's this? How you been able to navigate the last few weeks in that respect?
Well, I mean, as an actor, of course, I haven't been able to work because there's nothing filming. I'm based in LA, so nothing is filming here. Yeah, I have a company and we have projects in development and we're working on that. But they're, as far as revenue, no. And I think for me and my fellow actors, that's something that we have to look at when we're talking about getting back to work. Emotionally, of course, we all want to get back to work, because when you're not bringing in revenue, it's very scary. It's you have a family to take care of, you have bills. So wanting to get back to work is paramount, but also the actor is going to be the least protected person on set. And that's something that I think me and all my fellow actors are discussing. We can't film with PPE on. So how are we protected? How, from what Stacey was talking about with hair and makeup, yeah, we have to get our hair and makeup done, but how what kind of PPE is going to be involved? How are we going to, trust that the people that we're working with are being as safe as they can when they're not on set? Because here in LA, I think it's going to be, we can't quarantine when you're doing a television production. And when you're working at home, it's hard to, you can't just quarantine an entire crew and cast. Like, people are going to go home and they have their other family members that they work with and or live with, and so we have to think about how we're going to protect ourselves. I know that I've been talking to and dealing with SAG-AFTRA on how we're going to get back to work. I've been talking to them. They've been briefing me on everything they've been working towards, from the CARES Act to so many different things. And our union is staying on top of making sure that we are going to be protected with guidelines moving forward. But no revenue for I think most actors at this point, unless they have some kind of side hustle they can do where they're bringing in revenue, which, again, like I mentioned earlier, a lot of the revenue comes from jobs where you, again, have to interact with people. So actors have been hit from both sides.
Yeah, it's a great point. And Danny, just before I turn it over to Tom, I mean, you guys, and it sounded like, just from your first comments, Danny, you guys have really been putting together guidelines, best practices, and in the spirit of what John was just saying, in terms of, and when we go back, how we go back. How far along are you guys in sort of organizing all of that thinking, and what are the sort of remaining hurdles, areas where we can be supportive, things that we should just be aware of?
Yeah, we've been very thorough, talking to every union, every guild, having a lot of meetings and kind of gathering all the information of what needs to change, how is it going to change, and how it's going to keep everybody safe and still be feasible financially, as I spoke of before. A lot of things will change on an everyday basis on this film set. I think that we have technology of certain pieces of equipment that can change to keep less people away from the actors, remote heads on dollies, different pieces of equipment that can alleviate having as many people on a set at one time, and that'll help immensely. There are ways to do it. It's going to have to start from the top with the creatives and the writers and the directors, or we're all going to have to, as they say, be in this together to create content that is doable under the new protocols. And that's going to be the challenge, is to kind of put it into this bowl that we're going to be placed into. But I think with all the creative minds, I think that it is doable. And that's going to be the challenge, is to have the protocols placed in front of us, and to creatively have to figure out how to make it work safely under these new protocols.
I appreciate that. Tom, you've been listening in, and you've been part of many of these conversations and the larger conversations. Any thoughts, questions you have?
Well, I definitely appreciate everybody's input, and I'm definitely hearing a lot of concern with safety and support for the protocols and the phased, reopening of the California economy. The question that I have that springs to mind from listening to what everybody's been saying is this: we're hearing a lot about a need for safety. We're hearing a lot about how that may cost more, and that also that I think Ava's point that we can't miss this opportunity to make sure that we proceed with our deepest values moving forward. The question I have is, in some industries, the impact of this pandemic has accelerated changes within the industry. So that, for instance, just to choose one, in retail, people who are people who are doing basically online retailing have a huge advantage because of the pandemic that existed before, but the pandemic has accelerated their advantage over, in-store retailing. So as professionals who've worked in this industry for a long time, looking at what you guys have been talking about, the need for safety and the accompanying costs, with Ava's point about also wanting to be our highest values, is there something within the industry that this pandemic is going to make change, not just in the next month or two, but over time? Is it going to make it move to different places? Is there going to be, Ted was talking about all the different kinds of productions. Are there certain kinds that are going to become more feasible, relatively less expensive, more likely to do more programming going forward? Are there changes that we should expect as a result of this pandemic when we think about the future? So when we think about California, we should expect them and try and make sure that Californian workers and businesses are part of that change and are protected through that change.
Any of you guys want to jump in on that?
I could say that the stuff that we're working on, we've joined with the local 798, which is most of the East Coast, and the 706 is the West Coast, and under the IATSE, so that we can try to have some solidarity as far as what we agree the protocol should be, so that across the states, the requirements for safety don't exceed expectations, as far as financially. So we've been working all together so that, like was stated before, production may not maybe say, let's go to New Orleans and shoot. We don't have to follow these protocols. It won't cost as much money, and so on and so forth. So we're working as a union together, East Coast, West Coast, to try to have solidarity as far as what these protocols might be.
I guess, so there's not a race to the bottom.
Right. Exactly.
I think we're talking a lot about safety protocols, which is, wildly important and, kind of all we can do in this moment when we can't shoot. But I think the question that I'm hearing from a lot of crew members and just all of us that work is, when are we going to be able to shoot? Right? When can we shoot? And what is that going to look like? And how is it going to work for crew members who are not protected by unions, independent productions, where that stuff will need to really be mandated by the state, because there is no union to kind of oversee exactly what's done. And, so many questions about, a lot of the talk that I find myself in is what we're going to do when we reopen, but I can never seem to get my arms around the question for crew members that call me, and who are online and social media talking about this every day, as to what the walk back home to the set is going to look like. Can you share, either of you, share, any of the officials on the call, share a little bit about the forecast for folks who are watching, or, what it's feeling like to you? I know there won't be any absolute answers, but the spirit of the conversations that you're having?
Yeah, no, I mean, I think, look, we're hoping to put out some guidelines next Monday that will allow regions, allow counties primarily, based upon prescriptive criteria, based upon their self-attestation that they can produce a minimum number of tests. They have the adequate capacity to address the possibility of a community spread and hospitalization capacity, et cetera. All these criteria that we set out within an industry, we will allow them the ability on a regional basis, a county basis. At least we estimate roughly 53 of our 58 counties will have the ability. Doesn't mean they'll meet the criteria or can attest to the criteria to have containment plans, protection plans. But if they do, they can begin moving and your industry can start reopening. The challenge is, and I recognize it, and really I'm hearing it today, and it's very helpful, is this patchwork, especially for your industry, is even more challenging. But the good news is we are starting to see some light, and we are seeing data that allows us to make these decisions. But again, in that data is the reality that data can change based on behaviors changing. And people not, as you were saying a little bit ago, not self-enforcing or self-policing or being as responsible. And then all of a sudden, we're now going backwards, not marching forward together. But good news, I think, as early as next week.
So Monday, June 1st?
Monday, the May 25th. Yeah.
Oh, the 25th.
Yeah,
That Monday. Well,
so
fantastic.
we're working, and that doesn't mean the light goes on everywhere.
Yeah.
But it allows people, and so we're just trying to socialize this, get people to start really thinking and planning, and start to work in the spirit of collaboration. The challenge, and I'll be just candid, LA proper, the county, even today, the number of deaths that came in, disproportionate number came out of the county. They're seeing some good signs, which are very encouraging because of the outstanding work the county's done in the city in particular. And we're very proud of their work and working hand in glove with them. But it remains a challenging part of the state for us still. And so we are a little concerned they'll be a few weeks behind potentially everybody else.
I have a question.
I'd say that being a safe place to work is inextractable from being a great place to work. And that counts, for studios or states. So I do think that, keeping that balance in place is going to be one of those things that'll make the long-term difference. And I don't think anyone who's rushing, and if they're taking shortcuts on safety, I think it's going to have terrible long-term effects on them.
No, Ted, I appreciate that. By the way, just because I'd be remiss, are other states, are you much farther along in some other states, or, how's everybody else sort of faring in terms of marching in this direction?
I'd say not in practice. I think in meaning that there's nothing else happening any faster. There's a lot more talk about moving faster, maybe being a little more nimble in how to work with, like I said, the various needs of a specific production versus trying to come up with blanket regulation. So I do think there's some of that happening in other states that feels a couple of weeks different from us, but not dramatically.
Not dramatic. Stacey, you were going to say something? I'm sorry.
Sorry, Kat, I interrupted.
No, thank you. Please.
Oh yeah, I just, one of the things that stays on my mind at all times is we can implement all these protocols and get all the education and classes, and we can be in solidarity and learn how to work safely. But there's other things that we don't have any control of, and it's the access to like proper personal protective equipment. Like if some of those things aren't available to us, like how do we navigate being safe when it's part of being safe?
Yep. And by the way, thank you for that question, because that's foundational. I talked about testing and hospitalization. We could talk about ICUs and work that we're doing on tracing, isolation, and quarantine, but fundamentally just the simple capacity in your industry, particularly to have a mask that your customer can wear, and not just yourself and your colleagues. And the good news in that space is we have been procuring and distributing tens of millions of masks now. It's extraordinary what's happened in the last few weeks. We've been able to get these larger contracts. We have a list. I get an inventory every morning, over 70 million procedure masks, surgical masks now in an inventory coming in, millions a day, and we're trying to get millions of them out. And so we were all just last Friday to get 11 million masks out, childcare facilities, into the schools, which I know matters to you and many others watching, getting to senior centers, IHSS workers. We're starting farm workers, the foods supply chain to grocery stores. And we're going to be doing the same in your industry quite specifically in the coming days, weeks as well. So this is all concurrent and all part of the reopening process. That's why these masks are so much more than just providing for our frontline heroes, our nurses and doctors, but also for getting this economy moving again as well. Anne, do you want to close out, to sort of amplify anything that's on your mind as we move to get these guidelines in print and start to draft them?
Yeah, thank you, Governor. First of all, it's really powerful to hear all of you talk, and it's the creative industry always impresses me with how you approach problems, and so I just want to say thank you for the creativity that you're bringing to it. I think the governor just has an incredible urgency of now, and so I just want to let you know that he is really making sure that we are hearing you. Tom Steyer also has an urgency of now, and I am making sure that we're implementing as quickly as we possibly can to get these guidance out there. And Dr. Angel and Secretary Sue are working really closely to make sure that from a public health standpoint, from a labor standpoint, and then of course our business economic development team is working. So we are putting them together. We'd like to get them out by Monday. We will get them out by Monday. And then I think, the biggest hurdle that we have with regard to your industry right now is this regional problem with regard to Los Angeles. And so I don't want to sugarcoat that. And it is that we have increasing cases in the LA area. And so because of that, it is going to have some delays in the Los Angeles region. And I just want to be honest about that, because it's something that we are working really hard with LA County, with the public health officials there, with the elected officials in LA area. But I don't want to, say that it's going to be a switch on as quickly as it might be in other areas. So we'll work closely with you. We'll get this out on Monday. We'd love to follow up and make sure that we get, real feedback from you so we can do this the right way. Thank you.
Yeah. And I just in closing, I want to be respectful of everyone's time, and just a deep gratitude that you all took the time to participate in this, and for all the incredible work that you guys have done in general terms, and in the work that you're helping advance for us in specific terms. It's meaningful. And I just want you to know I also just deep respect and empathy for everything you guys are going through personally, not just professionally, as we all navigate these very challenging times. So thank you for the spirit that brought you here, and the incredible work that you've done that will be helpful and advancing our collective cause. Thank you all.
Thanks,
Thank
Governor.
you.
Thank you.
Thank you,
Thanks for
Governor.
having
Thank
us.
you.
But I do appreciate everybody. Thank you guys for being willing to do this. And look, I just want to jump in and even before others start coming on, and just thank you in particular from a selfish lens, and that is the need and desire from me to hear from you on the ground about the unique conditions and challenges you face, not only at the moment, but will face as we begin the process of moving into what we referred to today as phase 2, where we begin to move and adjust our stay-at-home order, to modify it, and to expand the opportunities for people to get back to work with modifications, with adaptations. And, it's one thing to say that, and it's another to do it. And, while I have just a little bit of my background, some experience in the private sector, starting restaurants and hotels, in some wineries, I have a sense of what those businesses need to reopen, but I don't necessarily have a sense of the businesses you're in and the unique characteristics, conditions, challenges. So I can only imagine the frustration when you hear from somebody like us, from me, mayors, health directors, where we say, hey, you can open up with 25% capacity. You probably sit there rolling your eyes saying, these guys just don't have a clue how our business runs, how it operates and it's managed. And so the answer, I imagine that frustration is very real and palpable, and we just wanted to acknowledge it, but B, take advantage of your experience, your unique conditions and circumstances, and learn from you, so that when we put together the guidance, particularly Sonia Angel, that's why I'm glad she's on the line. She is the tip of the spear. She actually writes the guidance for the state of California and helps to advise and gets influenced by the 58 county health directors. They will be determinative in this process, and we want to make sure your voice is part of the process of application implementation. So just, again, deep gratitude. And I want to also substantively thank Tom Steyer and Ann O'Leary, co-chairs of this Economic Recovery Task Force, and their partner, Sonia the Gap, who's also part of that broader task force, for helping bring in your ideas and recommendations into that broader group. So again, they can sector by sector begin to break things down and do justice. But there's no prescribed agenda here, and that's why I want all of you guys to really feel free to jump in. Let's try to have a two-way conversation, but more importantly, I really, for me, it's a listening opportunity, and I just want to get a sense. Maybe just Justin, I'll start with you, just because you're right in front of me on the screen. I know you work in at Patagonia, and it's a perfect example. What if you were to reopen? What the hell does it look like? How do you even manage it? How do you get your employees back? Tell us a little bit about what you've gone through and how you see things working in the future.
Yeah, I think there's a bunch of different things we have to look at. And I know, luckily my company is always going to put people over profit, which is great. But I think it's going to have to be a non-traditional open. We're still a few months away from being customer facing, even if that's something that comes up in the next couple of weeks. So I know the rollout that we're trying to look at and brainstorm would be just kicking off at the beginning with running as many warehouses. So supplementing our warehouse that's out of state. We always have the fear that if there is virus inside the warehouse, we're gonna have to lean on retail for shipping. So that would sort of be phase one. Then how do we go from that point to like buy online, pick up in store, like curbside? Do we do shopping by appointment? So we're looking at all of those things, but first and foremost would be to go off as a mini warehouse and sort of provide social distancing and like correct PPE for my employees inside the store. I know that's not going to be something every store can do because of space. In a store like mine, we do have a decent open floor plan that's, we can get to that.
So you can accommodate, just out of curiosity, Justin, your ability to bring back your employees, you're able to do that, you think, on pretty short order?
Once we do get back in, there's a lot of things we have to look at. A lot of my employees take public transportation. And is it going to be beneficial for those people to jump on public transportation and come in? I have some people that are ready to go now. I have some people that are caring for elderly family members that won't be able to. And then as far as volume, I know that you mentioned on your press conference today, like there's going to be demand driven by the consumers. And, I've got 25 employees that right now are not working. Even if I come back as a mini warehouse, I'm not going to have the demand for all of those to come back. So that's something I'm trying to weigh out right now.
I appreciate it. Mariel, you interestingly, you were working down at Santana Row, so you were kind of in a mall.
Yeah.
And then tell us a little bit about your background and what happened to you recently and where you see yourself going moment.
Sure. So I work at a retail store, an optical retail store, at a mall, like you said, in San Jose. And we actually were, the CEOs actually made an executive decision right before the shelter in place got put in place, to close all the stores because there is, I believe, a customer in another state that got infected, and she let the company know, like, okay, well, we're just going to close all the stores now, because the store, and just like the way our retail stores are, it's very close quarters. We're very close to like the people around us, and we're within like a foot of each other at all times. And so they made a decision to close the stores on March 14th. And so since then, when they told us that, they were like, we're still going to pay you the hours you were scheduled. And then from there, they assumed we would be back by March 28th. But of course, everything kept getting extended, which is fine. I definitely was not quite ready to go back yet, just with like the state of things and how like rapidly everything was going. And so they lessened hours, but we were still getting paid for those hours. And then about like a week or two ago, they made the decision to furlough all the retail and customer experience or customer service workers, with the intention to hopefully come back by, I believe, like the first week of June. And so right before getting furloughed, I was like, I made the decision just to apply for unemployment. Then that process it's kind of easy, but I definitely probably just needed, as like a first time person filing for unemployment, I think I just probably needed more clarification on like certain things. But I was lucky enough to have like friends who either know people who have done it or they've done it themselves. So it was nice to kind of have that. And then I actually got my EDD debit card yesterday. So
Nice.
it's all kind of worked
Like
out.
and Julie Sue, who's on the line. She wipes her brow. Let me ask you just, Mariel, it's interesting, just the experience of being a foot next to each other. I mean,
Yeah.
if you did come back and they did reopen, is it even possible to, I mean, what's your sense of your ability to even come back in the same?
I feel like just from a customer standpoint, I feel like people are probably more hesitant to come in. Just because there are certain things we do in store that like we kind of need to be close to like take measurements or like do certain things. So I feel like people would probably just be more hesitant to come in. They wouldn't really, I think from the company, it's probably be more about like building trust back into like the customer and like the company's relationship. But I think, yeah, it'll be a very interesting dynamic to have to come back after everything that's happened.
Interesting. And Myrick, you're in Fresno. And,
yes.
Yeah, and I mean, tell me, you've got an interesting company, interesting background. You've been able to sort of patch a few things together at the moment, but tell us a little bit about the journey you've been through in the last few weeks.
Yeah, it's been tough. You know, we went through a period of time where my employees, we had a little bit of work because we're doing some signs and bags for the census. And, but some of my employees had babysitting issues and just the fear of having their kids go to different places. And I was in fear of their kids going to different places and maybe come back and affect us. So, we're in the heart of West Fresno, which even before this happened, we had like a 22% unemployment rate. So our business is based around doing signs, banners, T-shirts, things that require large gatherings. So we're a little bit scared because once things open back up, football games, basketball games, soccer games, things that was probably 60% of our business is it's a lot of uncertainties. So what we're trying to do is we're a union print shop. So we're trying to rely heavily on those relationships as far as with workwear and different things like that we might provide. And we have been proactive because we're in a minority community that is a little slow on believing the message. So we've been taking it upon ourselves to create banners and signs throughout our community. Nice. Just letting people know that this is real. So we even sent a couple of proposals to our local council person and City of Fresno, and we haven't heard back yet, but we're still working on that. So we're just really just trying to restructure and reframe, our business, because I don't know if it's a good chance we're going to close down this retail component where people can walk in, because we just don't know. I mean, we definitely are afraid. So we have the capabilities to send things out. We have capabilities to produce products wholesale and retail as well. So maybe with the retail, we'll start relying on different places where we can go to sell our products direct to consumers.
And is Mark, were you able to get any loans? Were you able to, this PPP program, the SBA, there's the economic injury grants, and there's also these other disaster assistance grants, any of those things?
With all due respect, it's kind of like the United States lottery. So it's, we applied for it and we're in the queue. So we just have to deal with what's in front of us. I think one of the things, if I can suggest, we received some money from Access Capital Plus, which is some of the TAP and the CIP and the TAEP. So right now, at this particular point, each month we have to ask them for maybe a furlough or give us a little bit more time. So we were hoping that if something that we could do to maybe get 4 months where we don't have to really, hey, each month, hey, we're not open yet. Can you give us a little more time? I believe because these funds, come from you and the state, that maybe it could be some type of uniform structure to give us anywhere from 4 to 6 months that we can restructure our business to go back and start paying these loans. As you see, we have one right here. It's $1,800. That's actually due May 1st. So the economy is not open, and these are certain things that we have to deal with. So receiving any money, I haven't received any money, but our biggest thing is to call our creditors and say, hey, this is a situation, can you give us more time?
And has that gone fairly well with the creditors? Are they understanding, or are you getting squeezed because they're squeezed on the other end?
Yeah, we understand, with our landlord, we're paying those. We were expanding next door, that we were helping to bring local nonprofits together, and this way we can kind of advocate for the community. That building I had to let go. I have to focus on the for-profit business. And so as far as with the banks and some of those, I would say 50, 60% of them have been understanding.
Good to hear. Hey, Jim, you're out there in Mendocino. You've got what? You got a lot of employees. You got a bunch of different locations. I imagine consequence, a lot of different perspectives. How are you doing?
Yeah, I think hearing Marek and Judson, we've been essential. So we've been open through this whole process, but it's been a really challenge because as a small business, especially where, I've been doing this for almost 40 years, this is by far the biggest challenge we've ever experienced in my, that I can certainly remember. But I think one of the things that we said was very important when we started out, we said, number one, we're going to be open. We're essential. We're feeding pets and horses and livestock and the like. So like a grocery store, except we're for the four-legged versions versus the humans. So from day one, my staff is out there on the front line, and we set some criteria. First, we said, number one, you got to take care of yourself as our humans. How old are you? Are you able to work? Do you want to work? So take care of yourself. Number two became take care of your family. So this is a message we were putting out, becomes you have to go home to a daughter that maybe has a lung problem, like one of our employees, or what's your daycare situation? So how do you take care of your family? Number three became take care of your customer. We need to take care of our company, because if we're not profitable, if we're not able to run and sell, we can't stay open. And then finally, it was take care of our community and our customers. So it's a four-legged stool versus a three-legged stool, but none of them work without kind of that context. What that allowed us to do was basically have those one-on-one conversations with our team. How can we adjust? And I'll tell you, we've revised how can we function over the last 5 weeks at least a dozen times. And I'm pretty proud to say we've been kind of out in front of the orders, because oftentimes as an entrepreneur, we have to be thinking about the safety of my team. They're my extended family. Some of those people have been working with me for almost that whole 40 years. In fact, one employee's been there for that long. So how do we protect them in this environment? So plexiglass shields, face masks in our team, social distancing, sanitization of the actual shopping carts. This wasn't driven by a government regulation or somebody saying, here's what to do. It was really us deciding, back to that 4 criteria, how do we take care of my team? And how do I put them in harm's way every single day? And I'll tell you, the fear is real. And the hardest thing to comprehend is from your staff's perspective of understanding each one reacts to it differently. We have some members that say, it's not real, it's a myth, blah, blah, blah. We have others who are truly fearful in coming to work. One of the other criteria that we have is we have 5 locations. So we told our store managers, this is your call. I'm not going to dictate, nor could I ever dictate to you how to be open in this environment. Because if you're going to, and you need to be touching bases with every staff member. Half of our team left in Petaluma because they were over 65 years old. So now how do we stay open? We change that in through the process. And it's, I think the message that I really would like to leave in the advice is, let us be entrepreneurial. Let us, within the guidelines, make those guidelines as broad as you can and hold us accountable for, you know, we're talking right now, our team is socially distanced, we're masked, you know, we're sanitized. Our organization is protecting the community, and we know we've been ahead of every single directive, because that's been my primary job, is how do I protect my team? How to protect my extended family of my organization. So I think it's very difficult. I couldn't imagine trying to write a regulation around trying to open all these individual businesses unless you can keep it very broad. And then the accountability in today's world with social media, we have a grocery store operating in town that's not sanitizing their carts. They're getting hammered within this. Yet we're oftentimes being praised at having the cleanest store and the safest operation in the community. But I think as governmental agencies, if you remember, the market will drive behavior. And so you don't have to be so concerned with prescription. I think even whether it becomes I can imagine some hairdresser working and being a little opened up because they're being able to deal with the issues, and others not being able to. So that's the method I would serve, is how to do it, and how to allow. The other key issue for me is I have a store in Sonoma County, one in Mendocino, one in Lake. Each one of those counties has a different challenge and a different, some have social spread, some don't. Some have community spread, some don't. So we're often dealing with those stores, and it's up to my manager really to set the tone. And then it's a challenge of keeping morale. How do I talk to my team every day? And how do I get them to put on that mask and to go stand in front of sometimes a hospital? The primary emphasis is, I've got an 82-year-old father who lives in town. I have my daughter and my grandchild that live in town. And so taking care of my community is first and foremost to my heart. And as a small independently owned business, you are part of that community. You are a leader in that community, especially in our small town of Ukiah with 15,000. It's a big deal. So that's my perspective on it. That's how we've done it. We're struggling with, should we be advertising? Should we even be asking people to come in our store at this point? Or am I putting my staff at risk by doing so? So there's tons of challenges. There's tons of ethical considerations. But what has saved me through all this process is going back to my original thing. Number one, I'm looking each employee in the eye and asking my store manager, are you taking care of yourself? Are you okay? How's your income? What can we do? How's your family? Is this affecting them? Here's what we need in the company. And finally, here's how we address our community. So like almost the things you've laid out, your 4 areas of opening up this economy, I think provide some guidelines or some structure to kind of work within. And that's helped us tremendously of having that basic structure for our small little company. We can't rely on I can't rely on somebody to tell me what to do. We're building that from the ground up. But I'll tell you, we're making the big chain stores, and we're making the other retailers in our market catch up to us, because this is about me, this is about my family, this is about my people, and about my community. And you got to free up the entrepreneurs to let them be entrepreneurs and let them respond to this. And I think you'll be surprised.
I appreciate that, Jim. And I hope Dr. Angel is taking notes in terms of just that framework of flexibility and that entrepreneurial spirit and social persuasion and pressures, all those. Anyway, thank you. That was very insightful.
Sure.
Sonia, who's got a small retail company with I think 130 employees, or maybe 130,000. Sonia, give me a sense of what the gap's starting to consider and how things are looking. And you've got a global perspective, obviously, Sonia, not just a national perspective and a statewide perspective.
Thank you, Governor. Thank you for everything you're doing to keep California safe. And all the stories we're hearing today make up the stories of all of our employees within Gap Inc. And we're, as Governor Newsom said, we're 135,000 strong, about 20,000 in California, and we're in every community. So it is a story of town by town, community by community for our 300 stores. And we used to see 125,000 customers every single day in our California stores. And it's interesting, what we're seeing is our employees and our customers are anxious to get back to normal and get back to we know it's not going to be normal, but some semblance of re-engagement. And so, our journey through this is we want to work with you and with the government to be the gold standard for what safe retail looks like. And that is what we're doing with Tom Steyer and Anne and the rest of the coalition. And we can learn from our business in China, and what I can share with you all is we have upward of 250 stores in China that have now all successfully reopened, and we've reopened with great safety protocols that we've built. And that's a foundation for us around what safe retailing looks like. And on top of that, we've been operating our distribution centers and our stores as mini distribution centers to augment those safety protocols and add to them. And finally, we've been working with all of the professionals in the coalition to develop and the retail associations across the country to develop safe retailing principles. So we think we can bring all that to bear and help people get through this cycle, as Jim artfully said, around this fear for your employees and for your customers. There is a way out the other side, and we've seen it in China. We're seeing good business there, good business recovery, and customers and employees feeling safe with these new protocols. So that's the journey we're on, and we look forward to working with all of you and sharing those insights.
Yeah, Sonia, just out of curiosity, because it's fascinating. When you opened in China, what were the conditions? Just if you can think back to the first store that you were allowed to be open, what were the original guidelines? Was it just 10% of the foot? Give us a sense.
Right. I mean, we maintained nightly cleaning, social distancing of customers and employees, and mask wearing were the top three, as well as some plexi barriers, et cetera, at checkout. Now, it's a pretty light interaction relative to some of the heavier interaction industries in retail. So those have been good guidelines for us, and we've continued to refine them, and we'll continue to refine them. But we started there and built from there with good cadence. And so we continue to work with all of you to share those details, and expect that those can be a good foundation for those safety protocols. Plus, working across the retail industry, we're learning from the multi-category players that have been open and adding those insights in as well. So we feel confident that when it's safe to do so, as determined by Sonia, Angel, you and Governor, that we'll be ready and we'll be able to offer those guidelines for sharing as well.
Love it. And just Judson, I'm curious, just in Patagonia as a brand, is there sort of the mothership providing you guidance as a manager and you start thinking about reopening, or are they leaving in the spirit of what Jim's saying, that entrepreneurial spirit at the unit level and allowing you to make decisions? Because obviously the local guidance for you is very different than the guidance in other parts of the country and around the state.
Yeah, it's a little of both. So I think we have a team of people that are looking at local stores and which ones are least impacted when you look at numbers of cases of the virus or how people are getting to work. So sort of the determining factor of when a store can get in is determined at the headquarter level. And then sort of once we're in, that's when we can kind of flex that little entrepreneurial muscle. I know Jim was talking about all the things he was coming up with. I'm sort of, itching to get in there and get my hands on it as well. I'm ready to solve some problems, and I know that's something my employees are facing right now is that feeling of sitting on the sidelines. You know, I totally understand that an apparel store isn't essential. And it's a tough message to tell your employees that the job and career that they have chosen is not essential. So their paychecks are very essential. So it's a little mixed, but we're ready to get in there. And then for us, you know, a lot of my employees have chosen to be with Patagonia for the environmental aspect. I know Tom mentioned the green aspects when he introduced himself. You know, we kind of pride ourselves in being business to save our home planet, and we can't do that sitting on the sidelines. So it's like ready to get there.
It's interesting. Jim, just out of curiosity, I mean, you were able to source the PPE, the masks, without real problems, or did you have challenges?
Yeah, our masks were community made. Our masks were a function of a group of somebody we knew was making masks and, you know, volunteered, frankly, to bring us some masks and mask our team. You know, every 2 hours we do a staff change where we sanitize. We have a checklist of what we're sanitizing: doorknobs, counters. They sign off on that. They turn it in. Every 2 hours that staff change happens. So it's not every day, but it's every 2 hours. We have we also do a health check with our team when they come to work. And it's not so much about, do you have a fever? It's how you feeling? You know, what's going on? How are you today? And, you know, just today we had a staff member who just needed a day. He was having a hard day. So go home, you know, we'll figure it out. It's hard to figure it out when half your team is working one shift and half your team is working at others. And every transaction is expensive to do because we're taking it to the curb. So if you're not paying attention to each individual human being that's working for you, it's very difficult. That's been our secret of keeping some type of mission, you know, and some type of smile on their face.
Thank you. I love that. Sonia, do you guys have temperature checks in China? Is that part of the requisite?
Yeah, we're doing some temperature checking. You know, I also think that we are there's going to be a contract needed for citizens and for workers and employers, right? And citizens are going to need to do their part to make sure that me as an employer of 130,000 employees, that I can keep my employees safe. And so as citizens come in, they're going to need to commit to that, to taking their temperature, to wearing masks. And we as a people first employer will commit equally. So that is really, really important. I also want to comment on what Judson said about essential. You know, I really believe it's time for us now to move beyond this essential, non-essential debate and focus on protocols for safe retailing. Because, you know, for Old Navy, which is one of my brands, we service underserved families. And there's 10 million kids in California today. Many of those families do not have access to internet, do not have access to credit. Babies are being born, kids are growing, and their local store is their vehicle to get access to that product. So I think that, you know, 50% of retail today in the country is open, and somehow we have to shift from letting every citizen choose what is essential to them, because it is we're all individuals, but we have to commit to safe retailing, which we're ready to do, and citizens have to commit to doing their part as contribution to society. So that's where we're headed.
Love that, Sonia, because today we talked about sort of transitioning the nomenclature to this notion of low risk and beginning to move beyond just that foundational phase one, essential, non-essential, to low risk, higher risk, and then highest risk. But speaking of highest risk, Myrick, you sort of punctuated when you brought that home, that it is in that highest risk sector that is your business, which are the big events and the concerts and the team sports and the fans and everything else. I mean, I do worry about what you said about, you know, how you can navigate that and how, despite your incredible entrepreneurial talents, and I love the idea you were looking to, you know, expand next door and build partnerships and capacity with nonprofits. But maybe you can just amplify a little bit when you look out at the next 6 months, you know, and the prospects of some of those highest risk conventions and other things being the last to phase in. What do you really need from us in terms of the flexibility and support to be able to get through that?
You know, something maybe to be commissioned to help educate our communities in these hard to get to minority communities that's not getting the message. I think that by working with those communities it helps us all, because if they catch it, we all can catch it. So we really have to, you know, fine tune some of the generic messaging to fit some of the urban platforms, and we have the ability to do that. As far as, you know, I totally understand as far as the restrictions, as far as these large gatherings. So we're doing our part by trying to create different products that we can, you know, like I said before, sell online, direct to customers, work on those relationships as far as with city, state, county. You know, we are a union print shop, so we're definitely going to rely heavily on those relationships. But as far as having walk-in clientele, I'm scared as hell. I mean, you know, we have to. I don't think that we're gonna be able to open our doors to just anybody. You know, we're a small company, and you know, like I talk to my employees all the time. Hey, how's your family? How you doing? How's everybody feeling? Did your kids go hang out at somebody else's house? We have to know, because any movement or any consequence comes back on all of us.
Love it. No, I appreciate that sentiment. And Mary, I'll just briefly, I mean, you're listening to this, you know, from the biggest retailer, one of the biggest in the world, and some well-known brands, and then these amazing entrepreneurs in different parts of the state. And here you are, you know, you're not working, you were working. I mean, what do you want to hear in terms of just from your lens as an employee? What do you need to feel confident and comfortable coming back to work?
I think for me, it would probably just be making sure that like the higher ups and like the people at headquarters understand that like at a retail level, we're the ones that are kind of like in contact with all the customers and like all the people that come in. And maybe just making sure that like our concerns are heard, and just like knowing that they're like actually concerned and actually care about like our health, which I'm sure they do. But if we were to ever go back, I think just having a clear communication of that would be good.
I love that. Tom, I mean, you're co-chairing this remarkable recovery task force, and you've got extraordinary challenge of trying to break down sector by sector, all these nuances within each and every sector. And, you know, any questions you have in the group or just thoughts you have as you're processing this conversation?
Well, I do want to thank everybody for participating in this. And I do get a strong sense of everybody's commitment to living up to Governor Newsom's need to protect the safety and health of Californians. One of the questions I had, Governor, for all the different people on this is, as we move into opening and understanding that it's going to be not we're closed, we're open, that it's going to be a gradual process as the health statistics dictate. I mean, Sonia, when you look at what I looked at some of your proposals and I looked what you were doing in Hong Kong. At what level is that sustainable in terms of breaking even so that you can manage as these health statistics determine? And what does that mean in terms of the 125,000 people who were employed on, say, January 31st by the Gap, 25,000 of them in California? And in particular, what does it mean by level? So that the state can, I'm very interested to know how long we can sustain these partial steps and how it's going to impact human beings who have been your employees as we go through these different, you know, the gradual process of trying to get back to a normal society as opposed to one dictated by these health concerns.
Tom, it's a great question, and it's a very insightful one, because you know, we're all focused on surviving right now and getting people back to work and getting our customers serviced in a safe way. But we have to have sustainable, viable companies that can thrive. So how do we go from survive to thrive? And I really liked what Jim was saying around broad brush frameworks versus over specificity, because I think that's going to allow the innovation to happen to accomplish our safety goals without creating too much cumbersome structures that add costs, that add burden, that make companies therefore less sustainable. And we have to really focus on thriving so that we can continue to bring our employees back and keep them employed. Having an environment where we're only operating at 25% full strength or 50% full strength we can't live for very long that way. So we've got to be very intentional against your comments, Tom, and be innovative. But crisis is also an opportunity for us, and there are moments here where I think we're going to see great innovation and great leapfrog towards this end. And so that's the frame we have to have, I think. But we've got to create sustainable, profitable businesses for the long term that can be safe. Both are critical.
And do you have any additional thoughts or questions as we get close to our time?
Yeah, thank you, Governor. I mean, first of all, it's really, really helpful to hear what you're all going through. And I think as we listen, one of the things that becomes so evident is just the incredible commitment to public health, but also the recognition of the fear that people are experiencing, fear of your community getting sick, fear of your customers, fear of your employees getting sick. And I really appreciate, Mariela, your note, what you said, which is, make sure that you're thinking about us and thinking about the fact that we're at the front line, and I can hear that so much. And so I think that, as we do the work here, so honored to work with Dr. Angel and with people like Secretary Julie Su, I think, we do have at the forefront this notion of how can we reopen safely, and not only reopen, but, people like Jim and others are already open and can, in some sense, show us the way of what does it look like on best practices. I really appreciated what Jim said with regard to, listen, the market's going to let you know if you're not being safe and you're not being smart about how you treat people. And so I think that's also really critical. So I just want to say on behalf of all of us who are, working in and out here at the government level, just a great, great appreciation for you sharing your insights of what you're experiencing. So thank you.
No, and all of you reminded us, we talk about being guided by health and data, but health is not just attacking COVID-19. We have the health of our communities. We have the health impacts of being socially isolated at home and all of the underlying issues that come from social isolation and behavioral health issues that begin to develop. And then there's the economic health of our communities and how that is foundational as well. So when we talk about being guided by health, we have to sort of broaden that frame. And I think this is a reminder of that from a very sort of diverse group of folks. And so I'm really grateful to all of you. You didn't have to do this. Thank you for doing this. It's really helpful. And I'm so glad Dr. Angel's on the line, who's going to be responsible for drafting these guidelines. And so I really appreciate this notion of entrepreneurialism being reflected in those guidelines. And that's very helpful. And that's sort of distilling an essence of my takeaway and appreciation. Plus, if you don't have the lens of your workforce, then you're not serious about the work you're doing. And so, Marielle, thank you, but Jim as well, and Judson and Sonia, thank you for talking about your workforce, and Myrick, really thank you for putting that human face on these efforts as well. You guys are fabulous, and I'm really grateful for the time you took.
Thank you for listening and the time that you took out for us. Appreciate it.
Thank you.
My pleasure as well.
Yeah, thank you.
Thanks.
Thank you.
Thank you, everyone.
Thank you, guys.